Good afternoon, it's Dr. Larson here to talk about COVID-19. So I'm going to talk about a few things today. I'm going to talk about a few of the governor's mandates in regards to masking in K through 12 school, vaccination mandate for healthcare workers and state workers. I'm also going to talk a little bit about our numbers. I'm going to talk about breakthrough cases, and I'm going to talk about disease in children. So let's start with what's happening with our numbers. So our numbers are doubling every week. We are currently at an incident rate of 289 per 100,000 per 14 days, if you just take August 7th and count back 14 days. So we know our data here in Kittitas County is really good. We can count on that being accurate data. There's also data on the state, but our numbers are going up, and we had been well below 200 for a long time, but for the last 2 or 3 weeks, the numbers are going up. It's all related to Delta variant. It's about 98% of the current sequenced variants in Washington state, and it's much more contagious. They are not, if you remember discussing that almost a year ago, is the reproductive number of the virus, and to have this virus go away, we have to have that R naught less than 1. And we are currently at 2.1 in Eastern Washington, which means that for each person that's infected with COVID-19, they are infecting 2 other people. That is why our numbers are going up. So on Monday of this week, we had 7 people in the hospital with COVID-19. We've never had more than 3. 5 of those people were in the intensive care unit. 2 of them were transferred from here to here from other counties, 1 from Grant County and 1 from Yakima, due to staffing, not having enough staffing at hospitals. So we're starting to look at that. We're running out of staff to take care of people, and it's not just COVID, but there are people that fall and break their hips, or people that need a total hip replacement, or people that broke their shoulders, or people having heart attacks, and we're not having space for those people. So our numbers are going up in this state. Again, they're all related to the Delta variant. It is still, the vaccines still work for the Delta variant. So it's confusing because we think about vaccine breakthroughs, but even a vaccine that's 93% effective, you're still going to have some vaccine breakthroughs. And if I'm sitting in a room with a whole bunch of unvaccinated people, one of those people has COVID, and they've got a much higher viral load with this particular variant than what we've had before, it's quite possible that person will infect others, including myself, that are currently vaccinated. So that's a vaccine breakthrough. There's a really good article in the New York Times today that looks at hospitalizations and deaths in the United States by state of people who are vaccinated and people who are not vaccinated. Essentially, the bottom line is, for every single state, if you are unvaccinated, you are going to be more likely to end up in the hospital with COVID. You're going to be much more likely to end up in dying of COVID. So please get vaccinated. Vaccines are still safe, they're still effective, and they're really our only way out of this. So please get vaccinated. When we look at children, the governor has just mandated wearing masks for K through 12 school. That's a law. That's the governor's mandate. The school superintendents cannot change that. The school boards cannot change that. The Superintendent Reichdahl, who's the state school superintendent, has basically said if a school district would decide to go against that, they're going to lose funding. So please don't get angry at your school superintendent, your principal, your school board, because that is not their decision. That's the governor's mandate. And it doesn't really matter what our personal feelings are about masking in schools, mine, the school superintendent's. It's not really our decision to change that. So starting in this fall, the school, all children and staff, teachers, vaccinated or not, are going to have to wear masks in school. That's because of the Delta variant, much more infectious, and because the rest of us aren't getting vaccinated. So the problem is that we are choosing not to be vaccinated. So if we're choosing not to be vaccinated, it leads to a much more infectious variant, leads to things like mask mandates. In the county, our current recommendation is that if you are indoors, you should be wearing a mask. That's a recommendation. That's not a mandate. But as I walk around the county and I put my mask on when I go into the grocery store or when I go to the auto parts store, those type of things, it's obvious that people are not listening to that recommendation. But if we're surrounding ourselves with people who are not vaccinated, we are at risk of getting COVID-19 ourselves, transferring that to people who cannot be vaccinated, which includes those kids under 12, sorry. So please wear your mask indoors, unless obviously you're in a situation where you are surrounded by people that you know are vaccinated. And for the most part, we're not asking people, are you vaccinated or are you not vaccinated? We know our family members, maybe we know the staff we're working with, but so my recommendation as the county health officer is that you wear a mask indoors if you are around people that you are not in their immediate family because of the Delta variant. So there may have to be a mandate if our numbers continue to go up. That may be a state mandate, that may be a local mandate, but currently it's just a recommendation. The other thing that came out this week, again related to the Delta variant and low vaccination rate, is that we've been asking people to talk to their providers, talk to your pastors about COVID-19 vaccine, do your part, and our numbers are still not going up. We in healthcare are public servants. We are responsible for taking care of others. So the governor came out with a mandate for vaccination. All state employees, all healthcare workers. Healthcare workers is very broad. It includes chiropractors, it includes massage therapists, it includes people that give vaccinations, it includes the front office person at the hospital. Those people all by mid-October need to be fully vaccinated. That's where we're at. That's all related to Delta variant. Hopefully what we're going to see is as this Delta variant goes up, it'll go down quickly as it did in other countries, but we don't want to develop another variant either. So please get vaccinated. Please do it for yourself, do it for others, do it for those that can't be vaccinated, and take good care of yourself and be kind. Thanks a lot.